Welcome, listeners, to another episode of Optimal Anesthesia. Today, we delve into the intricate world of surgery, specifically the challenges faced by hypertensive patients with carcinoma buccal mucosa spreading to the tongue. Joining us to know more about the fascinating and sometimes complex interplay of hemodynamics during these procedures is an expert anesthesiologist. Picture this: the operating theater, buzzing with anticipation. But beneath the surface lies a complex symphony of stress responses. Driven by the body's innate mechanisms, surgical stimuli trigger a cascade of reactions, setting the stage for what's to come. But what happens when hypertension enters the scene? Our protagonist, the sympathetic nervous system, takes on a leading role, orchestrating a dramatic surge in catecholamines. This heightened response, fueled by the body's struggle to regulate blood pressure, adds a layer of complexity to the surgical narrative. But wait, there's more. Enter the baroreflex, the body's built-in regulator of blood pressure. In our hypertensive patients, this trusty ally may falter, struggling to maintain equilibrium in the face of surgical stress. As the plot thickens, the challenge intensifies, leaving our heroes racing against time. As our tale unfolds, we uncover another adversary lurking in the shadows: endothelial dysfunction. In the world of hypertension, this villainous foe disrupts the delicate balance of vasodilation and vascular resistance, amplifying the hypertensive response to surgical stimuli. But fear not, for knowledge is our greatest weapon in this battle for balance. And what of our protagonist's sensitivity to catecholamines? In our hypertensive heroes, this double-edged sword cuts deep, heightening their responsiveness to the stress-induced release of these powerful hormones. Yet amidst the chaos, a glimmer of hope remains, as we strive to unravel the mysteries of surgical stress. Now, we confront our greatest adversary yet: inflammation and oxidative stress. In the tumultuous world of chronic hypertension, these silent assassins lurk in the shadows, ready to wreak havoc on our heroes' vascular integrity. Now let's focus on this case. 1. The sympathetic nervous system, our body's guardian in times of turmoil. In the presence of buccal mucosa carcinoma, especially when it encroaches upon critical structures like the tongue, this guardian awakens with fervor, unleashing a torrent of catecholamines that sends blood pressure soaring. But fear not, dear listeners, for understanding this symphony is the first step to mastering the melody. 2. But what role does cancer play in this turbulent tale? With its cloak of inflammation, pain, and psychological strain, carcinoma adds another layer to our narrative. The very presence of this malignant force intensifies the body's response, fueling a surge of hemodynamic proportions. And as surgical stimuli enter the fray, the stage is set for a tumultuous journey of blood pressure fluctuations. 3. As our story unfolds, we navigate the treacherous waters of wide local excision and radial artery free flap reconstruction. With each incision and suture, the stress response amplifies, propelling blood pressure to dizzying heights. But fear not, for amidst the chaos lies opportunity to understand, anticipate, and ultimately control the surge. We are going to unravel the complexities and strategies for managing hemodynamics during these high-stakes procedures. Picture this: the operating room, a stage where surgeons perform feats of precision. But lurking beneath the surface lies a potential threat: prolonged hypertension. Like a tightrope walker teetering on the edge, our patient's cardiovascular system faces the risk of strain, with complications such as myocardial ischemia and arrhythmias looming on the horizon. Enter the radial artery free flap, a delicate construct susceptible to the ebb and flow of blood pressure. As our surgeons sculpt and mold, fluctuations in blood pressure become more than just numbers; they become lifelines for the viability of the flap. Meticulous control becomes paramount, ensuring optimal perfusion and preserving the integrity of our patient's reconstruction. Since our anesthesiologists are masters of their craft, wielding an arsenal of techniques to tame the blood pressure beast. With a keen eye for detail, they select anesthetic agents that dance delicately on the edge of sympathetic activation, minimizing surges and maintaining harmony within the cardiovascular symphony. Continuous monitoring becomes their trusted ally, allowing them to detect and address hypertensive spikes with precision and poise. Picture this: the moment of extubation, a pivotal point in our patient's journey to recovery. But amidst the anticipation lies a potential storm: an enhanced blood pressure response. As our patient takes that first breath of freedom, the surge in blood pressure threatens to disrupt the delicate balance of healing. Will our heroes navigate this tightrope with grace, or will they be swept away by the tumultuous waves? But the challenges don't end with extubation. Oh no, dear listeners, they are just beginning. In the postoperative arena, continuous monitoring becomes our guiding light, illuminating the path to stable hemodynamics. With each beat of the heart, we remain vigilant, ever watchful for any signs of delayed hypertensive responses. But fear not, for with adequate pain management and a calm recovery environment, we create a sanctuary where blood pressure storms are quelled and healing can flourish. And there you have it, dear listeners, a journey through the captivating world of blood pressure surges in buccal mucosa carcinoma surgery. Join us next time as we continue our exploration of perioperative mysteries, one story at a time. Until then, stay curious, stay informed.